With World Contraception Day coming up on Tuesday, there are growing calls for more access to sexual and reproductive healthcare and services. The day is aimed at bringing focus to the rights of all couples and individuals to decide freely and responsibly on the number and spacing of their children. For more on this, I'm joined by Tina Visser, medical lead at Bayer Southeast Africa. Tina, appreciate your time and happy Heritage Day. Family planning has shown remarkable results in reducing maternal and child mortality rates. Can you elaborate on the specific ways in which it can be improved?
Absolutely. It all boils down to, more education around people's sexual and reproductive health rights, and obviously information on contraceptive choices that they have. The more they know about the options available to them, the better decisions they can make about their life and what contraception options suit them best. This World Contraception Day, the actual theme around this day is to celebrate it every day on the 26th of September, or every year on the 26th of September, is around choices. So this year we want to make couples and individuals aware of the choices that are available to them, both in the private sector in South Africa as well as a public sector.
So I suppose with family planning, Tina, comes the conversation around child spacing. Now, certainly when I grew up, there was the going philosophy or theory, if you will, was around have one child now, another 5 years later, and then a further few years down the road have another. If you were having three, and potentially many had more. Nowadays, it's almost have 1, 2, 3 children if you're going to have three, one after the other. What's your take on what makes most sense?
Child spacing is crucially important. It's obviously important not necessarily to the mother's health, the infant's health as well, but then also for the family dynamics and then the socioeconomic factors that goes around that, and also financial implications. But if we look at the ideal spacing is around 2 years between kids, that is the best for the mother's body. But in the end, you need to make that decision in conjunction with your partner on what will suit you best, financially, obviously, and then with regards to your own health or mother.
Now, when we take a look at how our grandparents, and certainly their parents had children, many of them would have had half a dozen. My own grandmother had nine children. What are some of the factors that family planning negates or takes into account when you look at how many children one should have? What are the factors that are you looking at that contribute to the number of children that one is likely to have or should have?
Yeah, in the end, it is a personal choice. Just to start off with, I think that is, many couples also choose not to have children because I think, like you said, most of us come from large families. The tendency now is to have, the average woman in South Africa now is about around 2 children. So smaller families are key. I think the financial circumstances, especially in a country like South Africa, is obviously one of the major factors why people decide to have less children. But I think, we all want to have the best for the child. We all want to give our kids better opportunities and circumstances to grow up than what we had. And having fewer kids obviously is a way to go so that we could, give people better opportunities, provide for them better, give more security, all of those reasons. But in the end, it's not a decision that should be taken lightly. And that's also one of the things around World Contraception Day is that we want couples to engage in having this conversation around sex, around what contraceptive methods they are going to use, because also spacing your kids, or it will depend whether you have a short-acting contraceptive or you have a long-acting reversible contraceptive, or when you have finished your family, you kind of have, one of you have a sterilization in order not to have any children in future. It's really, we want to get the conversation going, but to make sure that every child, the vision of World Contraception Day and all the companies that are involved, and the organizations that are involved in World Contraception Day, is we want to have, let every child be a wanted child. and every pregnancy to be a wanted pregnancy. That's the main aim. So let's get the conversation going, especially between couples, on planning on when to have a child and whether to have a second child or third child. It's now done, and with the family is complete.
Now, Tina, as a Bay of South East Africa, you've actively been involved in supporting family planning initiatives. And what strategies have you found to be particularly effective in this region?
I think one major concern for us, especially in South Africa, is our huge number of teenage pregnancies. And when I say teenage pregnancy, we've seen the number of teenage pregnancies ages of 10 and 19 rise quite considerably. That COVID year from April 2020 to March 2021, there's 90,000 pregnancies in that age group. So we really need to educate people at a very young age about the risks involved in having a child that young, and also that you can give that child a better opportunity, make informed choices, not only for yourself, but for your offspring as well. Because, having a child at 10 or 12 really kind of ruins a girl's life. She really needs to make a lot of sacrifices. Her own life almost halted, or at least paused for quite a while. So they're not economically active necessarily in the community. So we really just want to have an informed decision on when to have the child, and that people know about their sexual and reproductive health rights. Kids, our constitution, a child from the age of 12 and up don't need their parents' consent to get a contraception. So we really need to educate at a much younger age around reproductive health.
Now, when we talk about those 90,000 that you've mentioned, is it a particular demographic, for instance? If you try to plot a chart, are there certain commonalities that you'd be able to pick up? Or is it just across the length and breadth of South Africa?
It is across the length of breadth in South Africa, but obviously among our lower socioeconomic, our lower LSMs, it tends to be more frequent. But yes, and also, I don't even think that those women know where to go when they do fall pregnant. Even if they decide to keep the baby, to have a healthy pregnancy. They don't know what clinic to go to. There's a lot of stigmatism, judgment, discrimination, and that's all that we want to solve. Especially that's our focus in Africa with World Contraception this day. Is to really alleviate and have a zone where people are free from judgment and free from discrimination, so that they can make the contraceptive choices, without feeling that the community kind of sidelining them or branding them as promiscuous or whatever the case may be. So we need to really, it's a huge mindset change that we make, because I do know that some people think if you have a child, you have hope for the future. But really to say, can I really afford that child? Can I give that child the best? And also, if you're 10 or 12 years, your own circumstances, you're a child yourself. You need to be raised psychologically mature to also raise a child then. So I think there's a lot of things that play into this whole mix. But yes, the community plays also a huge important part to uplift young people, to make them aware of their rights, to make them speak up, and to make them seek help at sources that will provide them with correct information. That's the other problem. The youth has got, there's so many myths and misconception around contraception. Using a long-acting reversible contraception like an IUD will lead to infertility, and all sorts of these sorts of things. So we really need to, as a community and as an organisation like Bayer that's got a very good investment in women's health, really to just raise the awareness, where to find good information, reliable information that you can discuss with your family planning clinic or with doctors. But yes, there is definitely a thing towards the lower socioeconomic group that there is a lack of information and education, a lot of misinformation.
Now let's talk about the men involved in this entire process around family planning, and I think that's a critical part of it. Do men cooperate, or are men a stickler in the process of the right family planning that works out for any individual or for any couple?
You know, men play a crucial part, and we do have all these contraception methods for women. Men basically have two, of which one is having a vasectomy, which we know is permanent, so that's not always the option. And then the other one is condoms. But condoms do play an extreme crucial role, because the condoms are the only contraceptive method that also protects against sexually transmitted disease. So I want to say, irrespective almost of either if the woman is on the pill or the injection or an intrauterine device, if she's using any of those contraception, in order not to get STI, it's crucial to use condoms as well. But yes, I don't think couples talk about it. Men kind of unfortunately think it's because the woman is going to fall pregnant, she needs to make, she needs to make a plan, and she's the one that needs to decide on the contraceptive method. But it's really something that the couple needs to decide on. And yes, men, it's a 50-50 game here. There's no one that needs to play a more important other one. But yes, we need to get talking to boys and young men and say, this is the responsibility that you need to take to make also a good decision, not for yourself and for your partner, but also for your community and for your future as well. Because you will always remain the father of that child. Nothing can change.
Now, Tina, you're medical lead for Bayer Southeast Africa. Does your territory cover other countries outside of South Africa?
Yeah, we're kind of a cluster of countries. Like I said, World Contraception is a national day that we celebrate every year. Bayer works closely together on an international level with a multitude of other organizations, non-profits, for instance, USAID, Planned Parenthood. So it's really on a global scale. Yeah, locally, Bayer is represented in South Africa, Namibia, Botswana, Zimbabwe. Then we also go up our Southeast Africa, is even a little bit of East and West Africa, also include large countries like India, Nigeria. So we really like to, spread the word in Africa. Bayer itself has committed to a sustainability goal of providing 100 million women in low and middle income countries with a modern form of contraception by 2030. So it's a tall order. And every day we wake up and like I said, our mission is together. It's the same as what the World Contraception Day's mission is. That is to make every child a wanted child.
So the reason I ask about what areas you cover is that figure of 90,000 that we talked about. That really shocks me. In fact, it's quite
only South Africa.
Yeah, it's quite a startling number. So let's talk about the other countries and the areas that you cover. Do they have a similar problem with those unwanted pregnancies amongst kids so young?
Absolutely. It's not unique to South Africa. It's a worldwide problem. So I unfortunately don't know the figures on the tips of my fingers, but yes, definitely not an isolated incident for us. We've even seen it in countries, I want to say developed countries. For instance, it's very interesting to see in Denmark, unplanned pregnancies or teenage pregnancies went down quite a bit during the lockdown periods. Or period that we had in 2020, or the serious lockdown that we had in 2020, because kids didn't go out of the house today, or young people didn't spend time. But as soon as lockdown was reversed, the teenage pregnancies again went up. So yeah, it's a universal problem. Young people, if you want to know it or not, are going to have sex, and we better make sure that it's protected sex that they're going to have.
So I'm glad you raised the issue of Denmark, because they're a first world country, and exactly. I'd imagine that the access to information is a lot greater than we have here on the African continent. So
Absolutely.
So where is the problem, or where is the solution rather? Because it doesn't matter how much information you have. If we're assuming that the Danish teenagers have all the information in the world, and the African or South African teenagers or youngsters don't have sufficient information.
It's a combination of factors. I do think, at school level, there definitely needs to be more education. Our Department of Health is also this week and last week had what they call blitz days at the universities to also improve for instance, blitz days in the Gauteng province universities, just to increase all the information around what contraception methods are available in the state sector to be of charge of different treatments. So yes, that's one part. We all need to play our role. From our side, people like to, young people are, social media mad, but with that, social media, there's also a lot of myths and misconceptions on social media. So what we've done at Bayer, and also with the international organizations, we do have an international website called yourlife.com. In South Africa, we've got a South African version of yourlifenow.co.za, which is specifically specified frequently asked questions. That's around each and every method. You can do a quiz to see which contraceptive method will suit you best. Take the answers to that to your clinic sister or to your doctor and say, I would like to know more. Which of these methods would suit me best? Because let's be honest, no single method can suit every single woman. Women are unique, and therefore they also have unique contraceptive needs. So yes, we do like, to use social media platforms, but Facebook pages, Facebook pages, Contraception Plus, as well as My Contraception, just sharing information on the platforms that we do know young people access quite a bit.
Tina, I appreciate this enthralling conversation as we discuss World Contraception Day coming up on Tuesday. Appreciate your time, Tina Visser, medical lead at Bayer Southeast Africa.